Welcome back to Body Beautiful. We have Dr. Joseph Mele with us, plastic surgeon, and we're counting down the top 5 cosmetic surgical procedures. Later, we'll be taking your calls, answering any questions you might have for the doctor. Here's the phone number, 415-561-8753. We'll also be posting the phone number to the doctor's office, so be ready to jot that down. Okay, drum roll, please. The #1 most popular cosmetic procedure in the United States is
no surprise, it's breast augmentation, and has been for years.
Does that signal some kind of, I don't know, shift in society and cultural ideal of what a woman's shape should be? I mean, but we're talking about breast augmentation, making bigger, right?
Making breasts bigger, yeah. You know, there's always going to be some cultural changes in terms of the ideal body shape and size and such. But I think most of my patients just want to be in proportion.
So let's take a
look. They're not really
look.
making a statement. They're just trying to get their bodies so that the top and the bottom match.
We have a picture, and let's show exactly what's happened here.
So here's someone who just wanted a little bit more. Her breasts were smaller than her hips, so when she's wearing clothing, it was harder for her to get a dress or an outfit that fit together well. By augmenting her upper part now matches her lower part.
And it also looks like she's lost some volume at the top there. Does that come from breastfeeding?
Actually, we've filled in the bottom from below. Oh, you mean before the surgery?
Before.
That's her rib. So that's where her rib is and her pectoralis muscle. So and then the breast itself, the volume is usually on the lower part of the breast.
Right. And so by adding the extra size up, it doesn't look
So what I've done is I put
larger.
an implant in and I've placed it behind the pectoralis muscle. And that allows me to give a nice taper on the upper part, so we don't get that really round, sort of half a coconut look. Yeah. We want that roundness at the bottom, but we don't want it at the top.
And that looks very natural.
That's, again, the plan.
That's your aim.
I like to keep them natural. Now I have patients who want to be double Ds. That's not going to look as natural. And they have to be comfortable with that.
And I have to ask you, I mean, is it the patient that comes in, she asks for the double D, or is it generally a partner that is
no,
requesting
she has
it?
to ask. If it's her partner, then it should not be done. Yeah, it's got to be for the person. That's the only reason to do augmentation.
And what's the average age of people that get breast augmentation?
No, it's a pretty wide range. I mean, it can be anywhere from the 20s up to the 50s, and I've had people come in even older than that who have been considering it for a long time.
You know, I've just made this empirical observation, and bear with me, this is not based on any kind of science, but have you noticed that people are booking more plastic surgeries now, just in the last, say, 3 to 6 months, because the economy certainly...
Because the economy is a little better.
I mean, this is elective surgery, and so
it's completely elective. It's not the cheapest thing you can do, so it's something a lot of people save for. And when the economy is bad and they're worried about if they have a job or not, they're not going to be likely to pursue that. But it has been getting better. This last year actually has been very good.
Okay. So that would indicate that maybe the economy's turned the corner. More people are getting more breast augmentations. When you say #1 is breast augmentation, that would be the enlargement. We're not talking about, because there are different types, right? There's reduction, there's lifts, there's...
Correct. Yeah, lifts actually came in at #7, so they
wouldn't even make the list.
Breast augmentation are done about 6 for each reduction that's done. So on average, about 1/6 of the number of breast augmentations, which is about 300,000. So about 50,000 breast reductions a year.
Now, I know that you see people who have had previous breast augmentations that either that were done improperly or that needed to be changed out.
Sure.
Is that part of this list?
Yes, I think the revisions would be part of what's included in the augmentation. And breast augmentation revision comes in many shapes and sizes. Sometimes things just weren't done correctly, but not the majority of the time. Often there's a change in the desire for size, which would require changing the implants out. Sometimes the implant will get firm. The scar around the implant will get tight, called capsular contracture, and that needs to be released and loosened up. And sometimes the implants fail. So sometimes we'll get an implant that just deflates. We need to replace it.
Over the years, and I know you're well aware of this, but there was a time at which there was concern about the silicone.
Correct.
And then that went away. So are there people that got the saline but didn't like the feel, and so then they're coming to you and saying, "Hey doc, now that
Now the silicone's been back sort of free on the market for the last 5-6 years. And a lot of folks who had saline implants that didn't like the firmness or had some wrinkling, they had some improvement with the change to the silicone gel. And very exciting, there's another company that's now available, or going to be available to sell implants, just got FDA approval, that also has these gummy bear implants, or these solid silicone implants available. When they'll be available, we still don't know. There will probably be some training required for board-certified plastic surgeons before they can use them. But the advantage of those is they can't leak.
Right, so no migration.
No gel migration. No.
Pretty solid there.
They're solid. They're soft, but they're solid.
Well, I know you'll let us know as soon as that happens. We need to take a quick break. For more information about Dr. Mele, you can call him at 925-943-6353 or check him out on the web at drmele.com or on sanfranciscobreast.com. We'll continue talking with Dr. Mele. Plus, we'll take your phone calls coming up on Body Beautiful.